The Admiral ripped the IV line from his arm and hurled the monitor stand into the wall hard enough to crack the drywall. 3 orderlies backed against the door. 2 security guards wouldn't go near him. The man had killed people with his bare hands on 4 continents, and every person in that room knew it. Then the rookie nurse, 29 years old, barely a year on the floor, walked past all of them, stopped 8 inches from his face, and said 2 words so quietly that only he could hear them. His fist dropped, his breathing slowed, and when he looked at her, it wasn't rage in his eyes anymore. It was something that looked a lot like recognition. Nobody in that room understood what had just happened, but every single one of them knew their assessment of Emily Voss had just been catastrophically wrong. If this story already has your attention, follow along, hit like, and drop a comment with the city you're watching from. I want to see exactly how far this story travels. Now let's get into it. The call came at 6:14 in the morning, which was how Emily Voss knew it was going to be a bad day. She was already in the break room on the 3rd floor of Caldwell Veterans Medical Center, pulling a burnt coffee from the machine and trying to remember if she'd eaten anything since Tuesday's dinner. The overnight shift had bled into early morning, the way it always did in a facility this size. Caldwell sat at the edge of Morro Bay, a mid-sized coastal city that housed 2 Navy installations and a marine logistics depot, which meant the patient population skewed toward men who had spent significant portions of their lives being shot at. They were not, as a rule, easy patients. The text was from the charge nurse, a woman named Doris Fell, who had been running this floor for 19 years and had the institutional memory of a federal courthouse. It said, "Room 412, come now. Don't bring anyone else." Emily drank half the coffee, tossed the rest, and went. Room 412 was at the far end of the ICU wing, past the double doors that required a badge swipe, past the nursing station where 2 of the overnight staff were huddled together talking in low voices that stopped the moment she walked by. The door itself had a handwritten note taped to it at eye level. Authorized personnel only. No exceptions. Below that, someone had added in red marker, "This means you, Hargrove." Emily pushed through. The room smelled like antiseptic and something older, sweat maybe, or the particular chemical signature of prolonged infection. The patient in the bed was a large man, 60s, with the kind of physical architecture that suggested he had once been significantly more formidable than he was right now. His face was gray beneath a week's worth of beard growth. His left forearm was wrapped in fresh gauze over what the chart would later tell her was a wound that had been debrided 3 times without clearing. His vitals on the overhead monitor were running ragged, oxygen saturation at 89, pulse unsteady in a way that looked less like arrhythmia and more like a man actively fighting something. Doris Fell was standing in the corner with her arms crossed, and the particular expression she reserved for situations she did not want to be responsible for. "Admiral Harwick Dolan," Doris said, keeping her voice flat. "Retired Navy. Came in 6 days ago with a soft tissue infection that the attending classified as complicated cellulitis. He's been refusing treatment since day 2. Refusing, Emily repeated. Pulled out his second IV. Disconnected his antibiotic drip twice. Yesterday he threw a bedpan at the resident who tried to do wound care." Doris paused. "He didn't miss." Emily looked at the man in the bed. He was awake, watching her with eyes that were sharp in a way that didn't match the rest of his condition. Whatever was wrong with his body hadn't touched his alertness. That was either a good sign or a dangerous one, depending on your perspective. "Why me?" Emily asked. Doris's expression shifted into something that wasn't quite guilt. "Dr. Calloway wants you assigned primary. Dr. Calloway runs the cardiovascular floor. He has nothing to do with this unit. He has everything to do with this unit when Dr. Lessing brings him in to consult, which he did yesterday afternoon." Doris lowered her voice, though the Admiral was clearly listening to every word. "There's been a discussion at the administrative level about your continued placement here. Calloway thinks you're unsuitable for high-acuity care. He's made that known." Emily kept her face neutral. She had been hearing variations of this since her second week at Caldwell, that she was too young, too inexperienced, that her background as a combat medic with the Army didn't translate meaningfully to hospital nursing, that she had certain habits and instincts that didn't fit the culture here. She knew what it actually meant. She had seen the way certain attendings looked at her when she flagged a medication interaction they'd missed, or when she questioned a treatment protocol in front of other staff. It meant she made people uncomfortable by being right in front of them. "So I'm being assigned to the case no one else can manage," she said, "because if I fail, it gives Calloway a reason." Doris didn't answer, which was its own kind of answer. "Fine," Emily said. "Leave me alone with him." Doris, I'll call you if I need anything." The door closed. Emily pulled a chair to the bedside and sat down without rushing, without performing the careful professional warmth she'd seen other nurses deploy like a tool. She just sat. The Admiral watched her. After a long moment, he said, "You're the one they don't like." His voice was rougher than she expected. Not from illness, exactly, but from decades of use at volume. "Apparently," she said. "Why?" "I'm still figuring that out." He looked at her steadily. "You were Army." It wasn't a question. She didn't ask how he knew. The way she'd walked in, maybe, or the way she sat. Combat veterans often recognized each other through small physical vocabularies that civilians never noticed. "Combat medic," she said. "Separated 4 years ago." Something moved behind his eyes. "Where?" "Places that didn't have official names on the paperwork." He was quiet for a moment, then, "They sent me a fresh kid who doesn't know anything about keeping her mouth shut. That's what they think of this situation. I think they sent me because they expect me to fail, and they want a convenient reason to move me out." She met his eyes. "I don't intend to fail, but I also can't help you if you won't let me work." "The last 3 people who tried to help me," he said slowly, "were following instructions I didn't consent to." Emily was still. "What does that mean?" "It means my treatment protocol changed 3 times in 6 days without my attending's signature on 2 of the orders. It means the first IV antibiotic they ran gave me a reaction that isn't in my documented allergy list, which means someone either didn't check or chose not to. And it means the resident who threw the bedpan at had been accessing my chart outside his assigned hours." She said nothing for several seconds. "You pulled the access logs," she said finally. "I had someone pull them for me. I still have people." He shifted in the bed, and she could see the effort it cost him. Not weakness, but pain he was managing rather than surrendering to. "I'm not being difficult because I'm scared. I'm being difficult because someone in this facility wants me too sick to leave, and I don't know yet who it is." Emily looked at the chart in her hands. She had glanced at it in the hallway. Now she actually read it. The antibiotic progression over 6 days told a story that didn't quite make sense. The first-line treatment had been appropriate. The switch on day 3 was documented as a clinical decision based on culture results, but the culture report in the chart was dated after the medication change. A small thing. The kind of thing that got lost in a busy unit, except it meant the decision was made before the justification existed. She set the chart down on the tray table. "I need to examine the wound," she said. "I know. And I need you to stay still while I do it." "I know that too." She unwrapped the gauze carefully, working without comment. The wound underneath was an angry, deep red oval at the forearm. Not large, but the margins were wrong. The surrounding tissue had a density that didn't look like standard infection. She'd seen wounds like this before, in places that didn't have official names on the paperwork, and they hadn't come from bacteria alone. She was pressing gently at the edge of the wound, checking for tracking, when she heard the door open behind her. She didn't turn around immediately. She finished the assessment note she was making in her mind, then stood and turned. Dr. Marcus Calloway was not a physically imposing man. He was perhaps 55, slim, with wire-rimmed glasses and a white coat that fit precisely and cost more than most people on this floor made in a week. He was the kind of physician who had the manner of someone accustomed to having his assessments treated as verdicts. Behind him were 2 people she recognized from administration: Sandra Pruitt, the Associate Director of Patient Services, and a man she only knew as Lessing's administrative coordinator. They had the arranged expressions of people who had been told this would be unpleasant and had decided to be unpleasant efficiently. "Miss Voss," Calloway said. He used the honorific deliberately. Not Nurse Voss, which would have been accurate, but the diminishing one. "I'm going to ask you to step out." "I'm in the middle of an assessment," she said. which you were not authorized to conduct. He moved to the other side of the bed, positioning himself between her and the monitor. Admiral Dolan is being transitioned to a different care team effective this morning. We're bringing in a specialist from the regional medical group. The specialist from regional, Emily said, is Dr. Ferris Vaught. He consults for 3 of the same defense contractors that had contracts with Admiral Dolan's last command. The room went quiet in a specific way. Calloway's expression didn't change, but something behind it did. That's an extraordinary claim for someone who has been in this room for less than 20 minutes. It's in the public disclosure database, she said. It took me about 4 minutes to look it up last night after Doris told me about the case. She hadn't known then that she'd be assigned. She'd looked it up because she was the kind of person who looked things up. I think before you make a transition of care involving a critically ill patient, someone should review that conflict. You're a floor nurse, Calloway said. You don't make those determinations. I'm flagging a concern. That's within my scope. Your scope, he said, and his voice took on the particular flatness of a man about to say something he'd rehearsed, is getting narrower by the hour. I've already submitted a performance review to HR noting your pattern of insubordination, your tendency to exceed your clinical role, and your consistent failure to integrate with the care team. What happens in this room in the next 5 minutes will determine whether that review results in a formal corrective action or a termination recommendation. From the bed, Admiral Dolan said nothing. He watched with the focused attention of someone cataloging information for later use. Emily looked at Calloway. She looked at Pruitt. She looked at the coordinator who had taken out a notepad and was writing something on it, though she couldn't see what. If I leave this room, she said, and something happens to this patient in the next 12 hours, that review will be the least of your problems. That's a threat, Pruitt said sharply. It's a statement of probable outcome, Emily said. The Admiral's oxygen sat has dropped 2 points in the last 8 minutes. His respiratory rate is up. That pattern is consistent with evolving pulmonary compromise. If you're going to transition care, you need to do it in the next hour, not the next day. And whoever takes over needs to be looking at his lungs, not just the wound. You've been here 20 minutes, Calloway said again, like repetition would make her wrong. 19, she said. But I'm right. Calloway looked at the monitor. She watched him look at it and then look away in the particular manner of someone who knew what they were seeing and had decided not to know it. Security will escort you out, he said. Gather your personal effects and report to HR before you leave the building. The 2 security guards who appeared in the doorway were not unkind about it. They were just doing their job, and their job in this moment was to stand in a way that made it clear the path to the door was the available option. Emily looked at the Admiral one more time. He was watching her with that same sharp, weathered attention. She walked to the door, stopped, turned back. Something had been pulling at her since she'd first walked in, a specific quality to the way he'd looked at her when she sat down. Veterans recognized each other, yes, but there were layers to recognition. There was the broad acknowledgement of shared experience, and then there was something narrower and older, a specific kind of register that only activated under particular conditions. She had operated in places that didn't have names on the paperwork. So had he. The math was possible. She took a half step back into the room. The security guards shifted. She ignored them. Cascade protocol, she said quietly. Just those 2 words. She said them in the cadence and register of someone who had once used them under very specific circumstances. The Admiral's eyes changed, not dramatically. Not the movie version of recognition, no sharp intake of breath. It was smaller than that and more complete. His attention, which had been focused and watchful, recalibrated, like a frequency finding a signal. Call sign, he said. His voice had dropped too. Ghost Finch, she said. He was quiet for 3 full seconds. In those 3 seconds, he looked at her the way people look at something they had filed away as gone and are now revising. You were the medic at Toval Ridge, he said. She didn't confirm or deny. She held his gaze. Then he said louder, not loud, but loud enough for the doorway. Nobody puts hands on her. Calloway said, Admiral, this woman is being removed from... Nobody, he said again, and the word had a quality to it that was less like volume and more like finality, puts hands on her. The security guards looked at each other. The coordinator stopped writing. Pruitt opened her mouth and then closed it. Calloway had the expression of a man who had prepared for several scenarios, and this was not among them. Emily stood in the threshold between the hallway and the room and understood, in the particular way that moments reveal themselves, that whatever happened in the next hour would not be contained within these walls. She also understood, though she had no way yet to prove it, that Marcus Calloway had known exactly what he was looking at when he saw Admiral Dolan's wound, and had made a choice about what to do with that knowledge, a choice that had nothing to do with medicine. She stepped back inside. "Admiral," she said, "I need to get a chest film, right now." "Do it," he said. Calloway stepped forward. "This is not—" "Do it," the Admiral said again, and this time he looked at Calloway directly. "And after that, you're going to explain to me why there's a man in a contractor's vest who's been walking the ICU hallway for the last 4 hours and hasn't entered a single patient room." Emily's head came up. The coordinator dropped his notepad. Calloway went very still. Outside in the hallway, somewhere past the double doors of the ICU, a monitor alarm began a sustained rising tone. Not the routine warning of a missed check, but the escalating sequence that indicated a patient in free fall. And then beneath it, something that wasn't a medical alarm at all. It was the hard, short burst of a radio, close enough to be on this floor. Emily Voss had heard that sound before. Not in a hospital. She turned to the security guards. "Lock the wing," she said. "Right now, both ends. Do it before you ask anyone for permission." They looked at her. They looked at each other. One of them reached for his radio. What came back on it stopped everyone in the room cold. "Chat." The voice on the security channel said 3 words that did not belong in any hospital on a Wednesday morning in Marrow Bay. Emily heard them and felt something in her body shift from assessment mode into something older and faster and considerably less polite. She was already moving toward the supply cabinet when the lights in the corridor outside flickered once, not a power failure, just a disruption, and then the double doors at the far end of the ICU wing slammed open. She pulled the supply cabinet open. Calloway was saying something behind her. She wasn't listening to him anymore. The man who came through the double doors was wearing a gray contractor's vest with a laminate badge clipped to the front, and he was moving with the specific kind of purposeful efficiency that had nothing to do with HVAC or electrical service. He was headed down the hallway toward room 412 at a pace that would put him at the door in approximately 11 seconds. Emily had 3 seconds before he cleared the nurse's station. She had a crash cart to her left, a wall-mounted defibrillator to her right, and 12 feet of open corridor between her and whatever was about to happen. She stepped into the hallway. The man in the vest was 22 years old, she estimated, well-conditioned, and had made the mistake of looking at the floor numbers above each door instead of the faces of the people in the corridor. By the time he registered that someone was standing in his path, she was already inside his reach. What followed took approximately 4 seconds and would later be described by 3 different witnesses in 3 different ways, none of which fully captured what they had actually seen. The orderly from the overnight shift would say, "She did something with her arm." The second security guard would say it looked like she knew where his hands were going to be before he put them there. Doris Fell, who had come through the south door at exactly the wrong moment and watched the whole thing, would say nothing for a long time, and then finally tell the investigator, "She didn't look scared. That was the part I couldn't get over. She did not look scared." The man in the vest was on the floor. Emily had his badge. The badge had a name and a company logo and a QR code access key that was keyed to a frequency she recognized from somewhere that did not have a name on any paperwork. She stood up straight. Her breathing was elevated but controlled. Behind her, in room 412, she could hear the Admiral's monitor alarm climbing. She turned and went back through the door. His oxygen saturation had dropped to 86. His respiratory rate was climbing. His left lung, she knew it before she even put the stethoscope to his chest, was compromised. The infection had tracked. What Calloway had been calling complicated cellulitis was not that, had never been that, and the wound at his forearm was not the origin point. It was a delivery mechanism. "I need a thoracic kit," she said to the room. Nobody moved. She said it again, louder, and looked at the supply nurse who had appeared in the doorway. "Thoracic kit, now, and call a code." "You're not authorized to," Calloway started. "He's going to lose the lung," she said flatly. "Call the code or step out of my way. Those are the two options." She heard Calloway make a sound. Not quite agreement, not quite surrender, but the specific noise of a man running out of positions to hold. And then the supply nurse was gone, and the code blue announcement came over the overhead system, and the room filled up with the controlled chaos that Emily Voss had been trained to work inside like other people worked inside silence. Her hands were steady. They were always steady when it mattered. That had been true in places without names, and it was true now in room 412 of Caldwell Veterans Medical Center, in a room that smelled like infection and institutional paint, under the fluorescent flicker of lights that someone had just briefly cut power to. The Admiral's eyes found hers through the crowding of the code team. "Ghost Finch," he said. His voice was strained, thin, but certain. "You're still fast." "Breathe," she told him. "I'll handle the rest." The thoracic kit arrived. She opened it with clean, practiced movements. She had done this before. Not in a hospital, but in circumstances where the absence of a hospital was the defining problem, where a man's lung had been collapsing in a valley that wasn't on any commercial map, and the nearest surgical suite was 400 miles away, and she had 17 minutes and whatever was in the kit strapped to her back. She had 17 minutes then. She had less than that now, and this time there were people watching. She made the first incision and did not look up from her work. Somewhere down the hallway, through two sets of doors, past the nurse's station, past the room where the man in the contractor's vest was now zip-tied to a chair, and a very confused security guard was trying to reach someone on a radio that kept giving him static. The exterior doors of Caldwell Veterans Medical Center opened, and a vehicle that was not an ambulance and not a police cruiser, and not anything the parking attendant had ever logged in his 17 years of working the morning shift came to a stop at the main entrance. The men who got out of it were in civilian clothes. They moved like people who wore other things when they were working. Emily didn't know that yet. She had her hands full. But the Admiral knew. Even through the oxygen mask, even in the diminished state his body was in, he had clocked the specific sound of that vehicle through the window, the weight of it, the particular resonance of its engine. And he knew what it meant. Help was not coming. Help was already here. The men from the vehicle were inside the building before the parking attendant thought to call anyone. There were 4 of them. They moved through the main lobby without stopping at the reception desk, without signing in, without the practiced hesitation of people navigating an unfamiliar building. They knew the layout. 2 went left toward the administrative wing. 2 came straight toward the elevators and took the stairs instead, which told Emily, if she had been there to see it, which she wasn't, that they had the floor plan and they weren't interested in being tracked by the elevator log. She was still in room 412 with her hands inside a man's chest cavity, and she needed to finish what she'd started before anything else in the building became her problem. The procedure was a needle decompression, not surgery, not the full thoracic intervention it would have been if she'd had another 10 minutes of deterioration to work with, but a precise, controlled release of the pressure that was collapsing the Admiral's left lung from the inside. She had done this twice before in her life. The first time she had been 24 years old, in a situation she still wasn't permitted to describe in detail, and her hands had been shaking from adrenaline and altitude and the knowledge that if she missed by 2 centimeters, the man would die faster than if she'd done nothing. The second time she'd been calmer. Muscle memory was like that. It didn't care how scared you were. This time her hands were not shaking. She wasn't sure if that was experience or exhaustion or the particular numbness that came from having too many things to process at once. The Admiral made a sound that was not quite a gasp and not quite relief, but something between them. The involuntary noise of a body finding pressure equilibrium after fighting against it. His saturation on the monitor began climbing. 86, 88. The code team, which had arrived with the coordinated urgency of people trained to respond to alarms, went slightly quiet as they watched the numbers move in the right direction. "Nice," said the respiratory tech. He was a young man named Garrett, who had been at Caldwell for about 8 months and had the honest face of someone who said what he actually thought. He was looking at what Emily had done with an expression that was somewhere between impressed and troubled, because the technique was clean and it was working, but it was also not the kind of thing you expected from a floor nurse on a routine ICU assignment. She didn't respond to the compliment. She was watching the Admiral's face. His color was coming back. Slowly, unevenly, the left side of his face was still gray, but the cyanosis at his lips was receding. His eyes were open and focused, and tracking her with the particular attention of a man who had spent a career making quick assessments of who in the room was actually competent. "Calloway," she said, without looking away from the Admiral. Behind her, a long silence. "Calloway," she said again. "I'm here." His voice had changed. The administrative authority was still present. That kind of confidence didn't dissolve in minutes, but there was something under it now. A thin crack. His chart shows a wound care protocol that was modified on day 3. The modification order has a timestamp that predates the culture results used to justify it. She kept her voice level, clinical, the way she talked when she was working and didn't have time to perform anything. "I need you to explain that to me. This isn't the time. When would be a good time? Because the patient whose treatment you modified without proper justification just had his lung decompress in front of a code team, and I'd like to understand the sequence of events before someone who outranks both of us walks through that door and asks the same question." She heard him shift. She heard him breathe. She heard him make the particular calculation of a man trying to determine how much he had to say and how much he could afford to withhold. She turned around. He was standing at the edge of the room, near the door, and his face had done something she hadn't expected. The precision was still there, the controlled professional composure, but underneath it was fear. Not the reactive fear of someone caught in a bad moment, something older and more deliberate. The fear of a man who had agreed to something and was now watching the price of that agreement arrive. "The protocol modification," she said quietly, "came from outside the facility." He said nothing. "The access log anomalies the Admiral flagged. The contractor badge keyed to a frequency that shouldn't exist in a civilian medical facility. The conflict of interest with Vought." She took one step toward him. "You didn't initiate any of this, but you enabled it. And right now that distinction matters a lot, because in about 20 minutes, the people who did initiate it are going to realize their asset on the floor is zip-tied to a chair, and they're going to start making decisions about loose ends." Calloway looked at her for a long time. Then he sat down on the supply stool in the corner, just sat down, like his legs had made a choice without consulting him, and put his hands on his knees. "I was told it was a monitoring protocol," he said, "that the treatment modifications were sanctioned at a federal level, and I wasn't permitted to ask questions." "Who told you that?" "A man named Pruitt." He caught himself. "Sandra Pruitt's husband. He works for—" Another stop. "He works for the contracting group." In the bed, the Admiral had been listening with his eyes half closed. Not unconscious, she knew, but managing his energy. At Pruitt's name, he opened his eyes fully. "Damien Pruitt," the Admiral said. His voice was thin, but the words were precise. "Director of Federal Contracts at Meridian Group. He's been trying to close a DOD audit for 14 months. That I have the documentation to reopen." He paused for breath. The oxygen mask was back on, but he'd shifted it to speak. "I was supposed to be too sick to testify. That was the plan." The room was very quiet except for the monitors. Garrett, the respiratory tech, had stopped moving entirely. He was standing in the corner holding a clipboard and looking like a man who had accidentally walked into something he wasn't meant to see and was now trying to calculate his options. Emily looked at him. "Garrett, what I need from you right now is to stay in this room, not make any calls, and keep monitoring his SATs." "Yeah," Garrett said. "Okay, yeah." She turned back to Calloway. "Where is Sandra Pruitt right now?" "She was in the administrative wing when I left." The door opened. The two men who came in were not in contractor vests. They were in the casual civilian clothing of people who don't want to be remembered. Dark shirts, unremarkable jackets, the kind of assembly that photographed as background noise. But they had the facility in their hands and the positioning of people who had done this before, and the one in front was looking at Emily with the focused assessment of someone crossing a room to deal with a specific problem. She had about 2 seconds. She used the first one to step left, putting the crash cart between herself and the door. She used the second one to pick up the defibrillator paddle from its housing on the cart, not as a weapon exactly, but as an object with weight and reach and electrical potential. And the man coming toward her was smart enough to register all three of those things and slow his approach by half a step. That half step was what she needed. "This is a federal medical facility," she said. "You're on camera in 6 angles and there are 17 staff members within earshot of this alarm." She held up the paddle. "I will absolutely use this." The man stopped. His partner had moved toward the Admiral's bed. The Admiral, who had been lying still and managing his oxygen, moved his right arm from under the blanket, and what was in his hand was small and black and extremely persuasive as a conversation ender. "I'm retired," the Admiral said. "Not dead." The partner stopped. For a long, brittle moment, nothing moved. Then from the hallway came the kind of commotion that was too organized to be panic. Rapid footsteps, multiple voices in the clipped cadence of people giving and receiving instructions. The distinct hard knock of boot soles on linoleum moving with purpose rather than urgency. The 2 men in the room registered it before anyone else did, because they were listening for it, in the way that people listen for things that mark the end of an operation. The man in front looked at Emily. She looked back at him. "That's your window," she said. "I'd use it." They left. She didn't know if that was the right call, letting them walk, but she had a patient on oxygen and a physician in shock and a respiratory tech who was on the verge of either fainting or having a very interesting story for the rest of his life. And she couldn't do everything at once. What came through the door 40 seconds later was not hospital security. The first man through was broad, close-cropped, wearing a badge on a lanyard that read NCIS in letters that were not decorative. Behind him were 2 more in similar configurations, and then a woman in a navy uniform with insignia that Emily's muscle memory identified before her brain caught up with the identification. 06 Captain, JAG Corps. The NCIS agent scanned the room with the practiced efficiency of someone doing a rapid threat assessment, and then his eyes settled on Emily. "Who are you?" he said. "Emily Voss. I'm the nurse assigned to this patient." "Were you here when the 2 subjects exited?" "Yes." "Did you detain them?" "I did not." He looked at the defibrillator paddle she was still holding. He looked at the Admiral, who had lowered his arm but not visibly relaxed. He looked at Calloway on the stool in the corner, who had the specific appearance of a man who had decided his best option was to say nothing until someone asked him a direct question. "Captain Lords," the NCIS agent said, without turning around. The JAG officer stepped forward. She was perhaps 50, with the kind of face that had been trained into neutrality over decades of practice. She looked at Emily with an attention that was different from the agent's, less assessment, more recognition, the kind that came from reading a file. "Emily Voss," she said. "Call sign Ghost Finch." Emily kept her expression still. "You want to tell me what happened in this room?" Lord said. "I want to tell you what happened in this room," Emily said. "After you tell me who knew Admiral Dolan was going to be admitted to this facility, because that's a question that has about 4 answers, and at least 3 of them are people who should not have known." Lords looked at her for a moment with an expression that might have been the beginning of something like respect. Then she turned to the NCIS agent. "Get me a secure room," she said, "and someone get this man a proper thoracic consult." She looked at the Admiral, who was watching everything from behind his oxygen mask with eyes that had recovered their focus. "Admiral, we need a statement." "You need more than that," he said. "Check the administrative wing. Sandra Pruitt has a laptop that I'm willing to bet has communications on it you're going to want to see before she realizes you're here." Lords turned to one of the other agents and said something in a voice too low for Emily to hear. The agent moved immediately, out the door and down the hallway, at a pace that was not running but covered ground as efficiently. Emily set the defibrillator paddle back in its housing. Her hands were steadier than they had any right to be. She looked at Garrett, who had not moved from his corner and was watching the room with the expression of a man taking mental notes he planned to process later, possibly with alcohol. "His SATs," she said. Garrett blinked, looked at the monitor. 93, coming up. Good. She pulled a fresh glove from the box on the wall and went back to the Admiral's bedside. She needed to redress the wound. The procedure had disturbed the gauze, and she needed to document what she'd done in a format that would hold up to review, because in about 20 minutes this room was going to become a site of evidentiary interest, and her clinical notes needed to be airtight. She was writing in the chart when Calloway spoke from the corner. "Miss Voss?" She kept writing. "Nurse Voss." A pause. "Nurse Voss." His voice was quieter now and had lost its practiced register entirely. "I want you to know that the performance review I filed this morning, withdraw it," she said. "That's all you need to say to me about it." Another pause. "Yes, I'll withdraw it." She finished the note, dated it, timed it, signed it, put the chart down. The JAG officer, Lords, was still in the room. She had been watching Emily work with the same focused attention she'd applied to everything else, and when Emily looked up, she didn't look away. "The two men who left," Lords said. "Can you describe them?" Emily described them. She was specific: height, build, approximate age, clothing details, the particular way the front man had moved, a scar above his left ear that she'd clocked in the 2 seconds he'd been close enough to see clearly. Lords' expression as she listened shifted incrementally towards something that was not quite surprise but was adjacent to it. "You got all that in 2 seconds, Lords said. "I got it in 1.5, Emily said. "The other half I spent on the paddle." From the bed, the Admiral made a sound that might have been a laugh and then turned it into a cough, because his lung was still angry and his body had stopped indulging him for the day. "Captain," he said when he'd recovered, "she saved my life twice this morning, once with a needle and once by being the most stubborn person in a room full of stubborn people." "Admiral," Lord said, "I'm going to need you to rest. I'll rest when Damien Pruitt is in a federal holding facility explaining his contracting irregularities to someone with a recording device. We're working on it. Work faster." Lords almost smiled. Almost. Emily turned to check the IV line she'd reconnected. The correct antibiotic this time, which she had verified herself against the Admiral's actual allergy file and the most recent culture results, which told a story about the wound's bacterial composition that pointed clearly away from anything that grew in a natural environment. She was making that note in her head, organizing it for the statement she was going to have to give, when her phone buzzed. It was a text from a number she didn't recognize. 6 words. No signature. They didn't come for him alone. She read it twice. Then she looked up at the room, at Lords, at the NCIS agent by the door, at Garrett watching the monitors, at Calloway folded in on himself in the corner, and thought about what 6 words could mean in a facility where 2 men had just walked out of an ICU room and disappeared into a building with 4 floors and 17 exits and a parking structure that connected to the street. She thought about Sandra Pruitt in the administrative wing. She thought about the agent Lords had sent in that direction alone. She thought about the text and the number she didn't recognize, and the fact that whoever had sent it had her personal cell number, which she had given to approximately 9 people in the last 2 years. She walked to Lords and showed her the screen without a word. Lords looked at it. Her face did something controlled and immediate. "Agent Marsh," she said to the man by the door. "Get me Kerrigan on the radio. Now." Marsh reached for his radio. Static. He tried again. More static. Not the random interference of a bad signal, but the specific, even blanketing of a device meant to produce it. Someone in the building was running a jammer. The lights in the hallway outside room 412 went out. The hallway went dark, and nobody moved for exactly 1 second, that involuntary freeze that happens when a sensory input doesn't match expectation. And then Emily was already at the door. "Don't open it," Marsh said. "I'm not opening it. I'm listening." She put her back against the wall beside the frame and listened. The emergency lighting had kicked in along the baseboards, casting the corridor in a low amber wash that turned everything flat and directional. She could hear footsteps. 2 sets, she thought, moving away from them toward the south end of the wing. Measured pace. Not running. Running attracted attention. Measured pace looked like purpose. "They're heading toward the stairwell B exit," she said. "How do you know there are 2? "Weight distribution. The floor in this wing has a hollow section near the nurses' station. You can hear the difference in resonance." She glanced back at Marsh. "It's an old building. You learn it. Marsh looked at her with the specific expression of someone revising a mental category in real time. Lourdes had her phone out. The jammer had killed the radios but hadn't touched cellular, which meant whoever was running it either hadn't thought through the gap or had decided the radios were the priority. Lourdes was talking in short sentences, the kind that got maximum information into minimum transmission time. Emily caught fragments. Building south exit. 2 subjects. Possible secondary target. Kerrigan not responding. That last part landed wrong. Kerrigan was the agent Lourdes had sent to the administrative wing. Not responding meant one of 3 things. His radio was in the jammer's footprint, he'd found something that required his full attention, or someone had made sure he couldn't respond. Emily didn't let herself settle on any one of the 3 yet, but she stored all of them. Admiral? She turned back to the bed. The laptop Pruitt was using. Do you know what's on it, specifically? He shifted against the pillow. His color was better, his breathing less labored, but he still had the drawn quality of a man running on reserve. Encrypted communications between Meridian Group and a contact inside the DoD Acquisitions Office. Transfer records, and the authorization chain for the audit suppression that I've been trying to surface for 14 months. That's the testimony, Lourdes said, from across the room. It wasn't a question. That's the testimony, he confirmed. Without it, every charge is circumstantial. With it, there are 9 people who lose their federal clearances at minimum and 3 who should lose their freedom. Sandra Pruitt knew that, Emily said. Sandra Pruitt has known it for 6 days, the Admiral said. She's had access to my chart, my admission records, and my room assignment since the moment I was brought in. She knew I had the documentation. She was managing the timeline, keeping me sick enough to delay and compliant enough not to escalate. And when you stopped being compliant, they sent the contractors. He paused. They sent them for the laptop first. I was secondary. Emily felt the sequence click into order. The man in the contractor's vest had been heading toward room 412 because the room number was what he had, but the laptop was already gone, or was supposed to be. Pruitt had been in the administrative wing. If she'd had the laptop and had time to move it, or destroy it, or hand it off. Lourdes, Emily said, where is Kerrigan's last known position? Lourdes checked her phone. Administrative wing, 3rd floor. He checked in 11 minutes ago. And the 2 subjects I heard in the hallway are heading for the south stairwell, which exits to the parking structure. Emily was putting it together as she said it, not performing certainty she didn't have. If Pruitt gave them the laptop, that's their exit route. If she didn't, if Kerrigan reached her first, then they're leaving without the primary objective, and this isn't over. She would have moved it before Kerrigan got there, Calloway said from the corner. His voice had the flat quality of someone offering information without effect, the way people talked when they were past a certain kind of shock. Sandra is not... She doesn't freeze. When she decides something needs to happen, it happens. Everyone looked at him. I've worked with her for 6 years, he said. I know how she operates. Lourdes was already relaying the information. Emily turned back to the Admiral's monitors. His saturation was holding at 94, which was the right direction. But she needed a proper thoracic consult in the next 2 hours, and she needed the IV antibiotic running cleanly. And she needed to document everything she'd done in a format that wouldn't get picked apart by whoever reviewed it later. She was reaching for the chart when Garrett said, "Someone's in the hallway." Not the 2 subjects from before. Different footsteps, heavier, more of them, coming from the north end of the wing. Emily listened. 3 people, she thought, or 4. Then the door opened, and it was Agent Kerrigan, and he was not alone, and his left jacket sleeve was torn at the shoulder in a way that suggested the last 11 minutes had been more physical than his job description typically required. "Pruitt's in custody," he said. He was breathing controlled, managing it. "She had the laptop. We have the laptop." Lourdes said something under her breath that was either relief or profanity or both. "She didn't come quietly," Kerrigan added, which explained the sleeve. "The 2 in the south hallway," Marsh said. "Being managed." Kerrigan looked at Emily. He had the same quality of reassessment in his face that she'd been seeing on people all morning. "Your Voss?" "Yes." "The man you put down at the nurse's station. The one in the contractor vest. He's talking." He doesn't have much useful to say, but he's saying it fast, which is usually a sign there's someone above him he's more scared of than us. He looked at the Admiral. Sir? Good to see you vertical. I'm not vertical, the Admiral said. I'm at a 30-degree incline. Relative to where you were 40 minutes ago, sir, that's vertical. The Admiral almost smiled. Then his face tightened, and Emily saw it before he said anything. The particular micro-expression of a man registering pain he's been suppressing and is now losing ground against. Talk to me, she said, moving to the bedside. Left side. Sharp, on exhale. She already had the stethoscope out. She listened. Right lung clear, left lung moving air, but with a quality that told her the decompression had bought time, not resolution. The pleural space needed proper drainage, or the pressure would rebuild. She could manage it here for another few hours with monitoring, but he needed a chest tube placed by someone with the right setup, and he needed it before the end of the day. I need to make a call, she said to Lords. I need a thoracic surgeon, not a consult, an actual procedure today. The facility's thoracic team has a conflict of interest that starts with Dr. Vaught, and I'm not putting anyone from that consultation group near this patient until someone has reviewed their meridian connections. Emily kept her voice flat. Call Harmon Regional. Ask for Dr. Adeyeze Solano. She's not affiliated with Meridian, and she's done this procedure in conditions that would make this room look like an operating theater. Lord studied her. How do you know Solano? We were in the same place at the same time once, in a location that doesn't have a name. She met Lords' eyes. She's good. Call her. A beat. Then Lords nodded and stepped away with her phone. The next 40 minutes were controlled and grinding and not clean in any way that would make a good story. The unglamorous work of stabilizing a patient in a compromised environment while federal agents processed a crime scene around her. Emily documented, monitored, adjusted the oxygen flow, rechecked the wound margins, and told Garrett at 8-minute intervals to read her the saturation number because she wanted it spoken out loud instead of just visible on a screen. It was a habit from operating in environments where screens weren't always there. Garrett read the numbers. He'd stopped looking like he was about to faint, which she appreciated. Calloway had been moved to a separate room. Not arrested, but separated, which amounted to the same practical outcome. He'd gone without resistance. On his way past the bed, he'd paused and looked at the Admiral. The Admiral had looked back and said nothing. That had been enough. The facility administrator who arrived at 9:40 was not Sandra Pruitt and was not anyone who had been in this building before 8 a.m. He was a man named Gideon Farr, sent by the regional VA Oversight Office, which meant someone had made a call that bypassed the normal chain of command, and the call had been answered faster than normal chains of command usually allowed. He came in with a tablet in a manner that suggested he had been briefed on the way over and was not happy about what he'd been briefed on, which Emily considered a reasonable response. He looked at the room, at the NCIS personnel, at the Admiral in the bed, at Emily, who was charting in the corner and had a small persistent bruise forming on her left forearm from where the contractor's elbow had connected during the hallway encounter. She hadn't noticed it until about 10 minutes ago and was choosing to continue not noticing it. Who's the treating nurse? Farr asked. That's me, Emily said without looking up. Name? Emily Voss. He scrolled on his tablet. Stopped. Scrolled back. There's a termination recommendation in your personnel file dated this morning. Calloway filed it. He told me he was withdrawing it before he was separated. It's not withdrawn. She looked up. Then I'd suggest that becomes someone's priority because I've been this patient's primary since 7 a.m. and I intend to remain his primary until the thoracic surgeon arrives. And if there's paperwork that contradicts that, the paperwork is wrong. Farr looked at her for a moment, then he looked at the Admiral. Is that accurate? He asked. This nurse has been your primary care provider this morning? She decompressed my lung, the Admiral said, disarmed an infiltrator, correctly identified a treatment conspiracy that 3 physicians missed, and told everyone in this room what was going to happen before it happened. He met Farr's eyes. So yes, she's my primary, and if someone tries to remove her again, they'll have the same conversation with me that the last group had. Farr typed something on his tablet. The termination recommendation is being flagged for administrative review, he said, in a tone that suggested it would not survive that review. Emily went back to charting. By 10:15, the facility was in a state that was not quite lockdown and not quite normal operation. Something in between that expressed itself as federal personnel in the corridors, an unusual number of vehicles in the parking structure, and the particular institutional silence that falls over a building when its staff understands that something significant is happening, but doesn't yet know the full shape of it. The morning nurses had been briefed to continue patient care on their assigned floors and not congregate, which they were mostly following with the exception of a cluster near the elevator bank on 2 that Emily knew about because Garrett had mentioned it on his way back from the break room. She told him to stay on the floor. He had. He was good that way. Dr. Adeas Solano arrived at 10:47 from Harmon Regional, which was 32 minutes faster than the drive should have taken, and she came in with a resident and a portable thoracic setup and the specific energy of someone who'd been given the relevant information en route and had used the drive time to think rather than to be surprised. She was mid-40s, direct, and looked at Emily with the brief warmth of two people who share a context they don't discuss in front of others. "Ghost Finch," she said, low enough that it didn't carry. "Solano," Emily said. "Your patient or mine?" "Mine until 30 seconds ago." Solano nodded and went to the bedside and began her own assessment, and Emily stepped back because that was how this worked. You brought in the right person and then you let them work. The Admiral tracked Solano's hands with the same focused attention he'd applied to Emily earlier, the old assessment habit, and after about 90 seconds he apparently decided she passed the evaluation because he stopped monitoring her and looked at the ceiling instead. Emily stepped into the hallway. The corridor was still dim. The main lighting hadn't come back in this section of the wing, and the amber emergency wash was still doing its flat directional work. Lourdes was 20 feet away, on her phone, and looked up when Emily came out. "Calloway is talking," Lourdes said. She'd ended the call. "Formally, his attorney is on video and he's providing a full account of the sequence of events. He was recruited 8 months ago through Sandra Pruitt. He was told the modifications to the Admiral's treatment were sanctioned under a national security framework, a classification level he had no way to verify or challenge. Did he believe it? He believed it for about the first 3 months. Lourdes' voice was precise and without editorial. After that, he chose to continue believing it because the alternative was expensive and frightening. Emily leaned against the wall and looked at the floor. People made choices. Sometimes they made them because they were venal, and sometimes because they were scared, and sometimes because the shape of their life had narrowed to the point where a bad choice, and the only available choice, looked the same. She didn't have uncomplicated feelings about Calloway. She wasn't sure she needed to. "What about the communications on the laptop?" she asked. "Our technical team is processing it. The encryption is commercial grade, but not military. They'll be through it within the hour." Lourdes paused. "The man who sent you the text. The 6 words." Emily waited. "We traced the number. It belongs to a former NSA signals analyst who left federal service 2 years ago under circumstances that are still classified. He's been a peripheral figure in the Meridian investigation for several months. He contacted our office 6 weeks ago with information that we couldn't fully verify at the time." Lourdes looked at her. "He knew you were at Caldwell. He knew the Admiral was here. He's been monitoring the situation from outside. Is he safe?" "We're working on locating him now." "That's not an answer to what I asked." "No," Lourdes said after a moment. "It's not." Emily straightened up. "The 2 subjects who went south, did anyone pick them up at the parking structure?" "One was detained in the structure. The other exited the building before we had the perimeter established. He's in the wind." She registered that and filed it in the category of things she couldn't control but needed to know. "The one who's in the wind," she said. "Was he the one from the hallway? The front man? The one I faced?" Lourdes said nothing, which was the answer. Emily pushed off the wall. "Then this isn't over." "No," Lourdes agreed. "It's not." Inside room 412, Solano was prepping the chest tube placement, talking to the Admiral in the level, matter-of-fact tones of a surgeon who wants a patient calm without condescending to them. Garrett was by the monitor. The room had the focused, functional atmosphere of a procedure being done correctly, which was the best thing Emily could say about any given 10 square meter space right now. She went back in and stood where she could see both the patient and the door. The Admiral looked at her. He'd had a local anesthetic for the procedure, and his face had relaxed fractionally, which made him look older. The held tension had been doing structural work. "You're still here," he said, "until you're stable. I've been in worse shape than this." "I know. You were in worse shape than this at Toval Ridge." She said it quietly, not for the room. "You were also 3 days out of surgery and running a fever of 103, and you still managed to coordinate the extraction. So I'm aware of your baseline." He was quiet for a moment. Solano worked. The monitors ran. "The man who got away," he said. Not a question. "Lords is on it. She's good, but the man she's looking for doesn't stay in one place long enough for good to catch up with him." His eyes had that quality again, the one that saw things arranged across time rather than just the present moment. "His name is Varel. He's been with Meridian for 4 years, but before that he was somewhere else, doing something else, and the record of that is the part that's missing." "How do you know this?" "Because I've been building the file for 14 months, and Varel is the name that kept appearing in the margins." He paused for breath. "He's not a contractor. He's the person the contractors call when contractors aren't sufficient. And he's in the wind." "He's in the wind," the Admiral confirmed. "And he knows that the laptop is gone, and the operation here has failed, and that means the calculation he's working from right now is damage control. He'll look for the weakest point." Emily thought about what the weakest point was. She thought about the NSA analyst who'd sent 6 words to her cell phone and was now unlocatable. She thought about the fact that Varel had been in this building less than an hour ago, moving with facility knowledge that didn't come from a floor plan. She thought about the things she hadn't said to Lords, because she hadn't been certain enough to say it until right now. The jammer that had killed the radios hadn't killed cellular, which meant it wasn't designed for broad-spectrum suppression. It was designed to kill the specific frequencies used by hospital security and federal law enforcement radios. Narrowband. Targeted. That required knowing which frequencies to target in advance. Someone had given Varel the facility's communication protocols. Someone inside. Not Calloway. He didn't have that access. Not Pruitt. She was an administrator, not a systems person. She looked at the room. She looked at the monitor. She looked at Garrett, who had been here since the overnight shift. Garrett, who had arrived in the room 8 minutes after the code blue was called, which was fast for a respiratory tech responding from another floor. Garrett, who had not reached for his own phone once during a morning in which everyone else in the room had reached for theirs multiple times, because he knew his phone would be logged. She kept her face very still. She looked at the monitor readings. She looked at the IV line. She looked at the supply cabinet behind Garrett's left shoulder, where the emergency override panel for the floor's communication relay was mounted behind a panel that required a specific key. The panel was ajar. She looked back at Garrett. He was looking at her. And the thing in his face was not the open, honest affect of a young man who'd stumbled into a frightening morning. It was the particular stillness of someone who'd been waiting to find out how long it would take her to see what she was looking at. "Garrett," she said. "Yeah," he said. His voice was the same as it had always been, and that was the worst part. Perfectly calibrated, right up until it wasn't. His hand moved toward the supply cabinet. His hand was 6 inches from the supply cabinet when Emily stepped between him and it. She didn't touch him. She didn't reach for anything. She just moved. One clean step that put her body in the space his hand was traveling toward, close enough that stopping was the only physics available to him. He stopped. His face ran through something fast and complicated, the microsequence of a person recalculating in real time, and she watched it happen with the particular attention she'd developed in places where reading a face in 2 seconds was the difference between a manageable situation and an unmanageable one. "Don't," she said. One word. She didn't explain it or expand it, because anything she added would give him more information than he currently had about how much she knew, and she wanted to preserve that gap for exactly the next 45 seconds. Behind her, Solano was in the middle of the chest tube placement and could not stop what she was doing. The Admiral was flat on his back with a local anesthetic doing its work, and enough awareness left to understand that the temperature in the room had changed, but not enough positional freedom to act on that understanding. The two NCIS agents who'd been in the hallway were not in the room. So it was Emily and Garrett and the supply cabinet panel that was ajar, and whatever was inside it that he'd been moving toward. He looked at her. She looked at him. He was 26, she now thought, not the 28 she'd estimated earlier. Up close, with the affable performance stripped away, he looked younger and more tired than he'd presented all morning, the way people look when they've been holding a shape for a long time and the muscles have started to fail. "The panel behind you," she said quietly. "Is there a device in there, or is it an access point?" A beat. He was deciding what admitting anything cost him. "Access point," he said, not loudly. "For the jammer. Relay switch. I flip it. The jammer repositions. Covers the stairwell exits instead of the wing." She understood immediately. "Because Varel is trying to come back in." Garrett's silence was the confirmation. She turned her head slightly, keeping him in peripheral vision. "Lords." Lords was not in the room, but she was close. Emily had heard her moving in the hallway 12 seconds ago, the particular cadence of someone pacing while on a call. She raised her voice just enough to carry through the half-open door. "Lords, I need you in here." 3 seconds. Then Lords was through the door, taking in the geometry of the room, Emily's position, Garrett's position, the cabinet, with the rapid, accurate reading of someone whose job required it. "He's the relay operator," Emily said. "The jammer is remotely repositionable. Varel is attempting re-entry." Lords had her radio up before Emily finished the sentence. The radio had been functional again for 20 minutes. The jammer's initial footprint had been temporary, Emily suspected, because Garrett hadn't been able to maintain it without becoming obvious. And Lords used it now with clipped precision, coordinates, and directives that Emily only half followed because she was still watching Garrett. He hadn't moved. He had the look of someone who'd arrived at a decision, though she couldn't yet tell what the decision was. "Garrett," she said, "whatever you're calculating right now, I need you to factor in that the man you're protecting has already left one colleague in federal custody and one in the wind. He is not going to come back into this building for you. He's coming back for the laptop." "You don't know that." "I know he's been running the operational side of this for at least 4 months. I know the contractor in the vest was a $200 an hour body, and Varel is the person the contractors call when they need something done correctly. I know that the relay switch in that cabinet was placed during a routine maintenance window 6 weeks ago, which means you've been here for at least 6 weeks, which means you are not a Harmon Regional Respiratory Tech, and you've been playing this role long enough that you're probably tired." She kept her voice even. No heat, no performance, just the facts arranged in order. "If you flip that switch, you become an active participant in a federal obstruction charge on top of everything else. If you don't, you're a cooperating witness with information about Varel's re-entry plan, which is the most valuable thing anyone in this building has right now." He looked at the floor. "The people who recruited you," she said, "made promises they have no mechanism to keep. That's always how this works. You're not getting a lawyer paid for. You're not getting protection. You're getting used, and then you're getting distance." A long silence. Solano worked. The monitors ran. "He's coming in through the loading dock," Garrett said. His voice had gone flat and careful, the way people talked when they were crossing a line and wanted to do it cleanly. "West side, sublevel. There's a maintenance corridor that connects to the pharmacy receiving area. He has a key card." Lords was already on the radio. "How many with him?" Marsh said from the doorway. He'd appeared without Emily noticing, which meant Lords had signaled him. "I don't know. He didn't tell me numbers. He never tells me numbers." "What's the objective?" "The laptop, and—" Garrett stopped. "And," Lords said. Garrett looked at the Admiral, then at Emily, then at the floor again. "The witness." He said the witness couldn't testify. The room went quiet in the particular way it went quiet when a statement removed ambiguity. "The Admiral," Emily said. "I didn't know they meant—" Garrett's voice cracked slightly. He pressed it flat again. "I thought it meant delay. Get him out of the facility before he could testify. I didn't know it meant—" "Sit down," Emily said. Not unkindly. "Sit down right there and don't touch anything." He sat on the floor with his back against the wall, and Marsh was in the room by then and had the angle covered. and Emily turned to the Admiral. He was looking at the ceiling. Solano had finished the chest tube placement. It had gone in while the room was doing other things, which was exactly what competent surgeons did. And his breathing was already easier, the labor gone from it, the left lung reinflating with the particular slow stubbornness of tissue that had been compressed and was now remembering its function. "You heard that," Emily said to him. "All of it," he said. "We need to move you." "I know." "Your post-procedure, the tube needs to stay in and monitored. If we move you to a different room, I need to know you can manage the discomfort." "Voss," he said, and the way he said it was patient and a little tired and carried the weight of a man who'd been managing discomfort since before she was licensed to practice nursing. "I've had worse in a ditch." "I know you have. I'm documenting this." "Document it then. Let's move." The transfer took 11 minutes. Emily, Solano, and Garrett, who was not under formal arrest and whose continued cooperation was the reason for that, moved the Admiral to a room on the opposite end of the wing, a room that had 2 fewer windows and 1 fewer access door and had been confirmed clear by Marsh before they brought him in. The chest tube traveled with him, secured and monitored, the drainage system functioning correctly. His vital signs during the transfer were stable enough to constitute a minor medical achievement given the morning he'd had. They put him in the new room, and Emily documented the transfer, and Solano signed off on the clinical notes, and then Solano looked at Emily with the particular directness of someone who had known her in a context that stripped away professional ceremony. "You doing all right?" Solano asked. "Ask me in an hour," Emily said. Solano nodded. That was the correct answer, and they both knew it. "I'll be down the hall. Flag me if his drainage output changes." She left. Emily checked the tube one more time, checked his IV, and sat in the chair beside the bed. The Admiral had his eyes closed. She thought he might be asleep until he spoke. "Verrill was recruited out of a military intelligence unit that was decommissioned in 2019, he said. "The decommission was quiet, too quiet. The unit had been running off-book operations for contractors since at least 2017, which is what the audit was meant to surface. That's what's on the laptop. That and the names of everyone who signed off on the operational framework. 14 names. 2 of them are currently serving on the Senate Armed Services Committee." Emily sat with that. "So the testimony," she said, "isn't just about Meridian." "The testimony is about a system," he said. "Meridian is one arm. There are 4 others. The audit documentation I've been holding connects all 5 to the same authorization chain." He paused. "That's why they needed me silent. Not just delayed. Silent." She understood now, with a completeness she hadn't had before, the full weight of what had been happening in room 412 of Caldwell Veterans Medical Center for 6 days. It wasn't a man refusing treatment. It was a man holding a thread that, if pulled, would unravel something much larger than one federal contract or one corrupt administrator. And she had walked in at 6:14 in the morning because the charge nurse had sent her a text, and she hadn't eaten since Tuesday dinner. "The bruise on your arm," the Admiral said, without opening his eyes. She looked at her forearm. The bruise from the contractor's elbow had developed into something more definitive over the last hour. A dark, spreading impression that was going to be colorfully present for the next 10 days. "It's fine," she said. "I know it's fine. I'm noting it for the record." "You're not in a position to note anything for any record. You just had a chest tube placed." "The record will reflect," he said, with the precise inflection of a man who had been giving formal statements for 30 years, that Nurse Emily Voss sustained an injury in the course of protecting this patient and this investigation, and that the injury was not treated by anyone before she went back to doing her job. "I've had worse." "I know, Toval Ridge. You had a through and through on your left shoulder, and you finished the extraction before you let anyone look at it." He opened his eyes. "I was conscious for part of that." She hadn't known he'd been conscious for any of it. "Rest," she said. "The situation outside is being managed. By Lords and Marsh. Yes. Lords is good. Marsh is adequate." He closed his eyes again. "Stay close." She stayed close. What was happening on the sublevel of Caldwell Veterans Medical Center in the 30 minutes that followed was not clean or sequential or fully visible from room 412. It came in fragments, the way real events arrived. Through Marsh's radio updates and Lords's brief appearances in the doorway and one stretch of 12 minutes where nothing came through at all, and the silence had a texture to it that Emily understood from experience. Verrill had come in through the loading dock as Garrett described. He'd had a key card, and he'd had the maintenance corridor, and he'd had the specific efficiency of someone who had done the facility reconnaissance himself rather than delegating it. What he hadn't had, what Garrett's cooperation had removed from his operational picture, was the knowledge that the relay switch hadn't been flipped, that the jammer hadn't repositioned, and that the 6 agents who had moved to the sublevel in the preceding 11 minutes had done so through routes that stayed outside the jammer's static footprint. He'd walked into a corridor that was already covered. He hadn't come alone. There were 2 others, neither of whom was the front man from the hallway, who was still being processed in a federal facility across town. One of the 2 had a weapon that he didn't get to use. The other had a bag that turned out to contain not a weapon, but a portable data recovery device and an incendiary element, which told Lords everything she needed to know about the backup plan when the laptop wasn't recoverable. The takedown in the sublevel corridor lasted under 90 seconds. Nobody got shot. This was not because it was elegant. Marsh had a split lip from a door frame, and one of the junior agents had a wrenched knee. She was walking off down the hallway, but because the positioning had been correct and Garrett's information had been accurate, and accuracy was usually the difference. Verrill was in custody by 11:42 a.m. Lords came to room 412 at 11:51 and told Emily first before she told anyone else in the building. Emily didn't know why she did that, whether it was professional courtesy or something more specific to this morning, but she noted it. "He's not talking," Lords said. "He won't," Emily said. "Not yet. Not to you." "What does that mean?" "It means the 14 names the Admiral mentioned are people with the resources to make Verrill's cooperation very unprofitable. He'll calculate whether we have enough without him before he says anything." She looked at Lords. "Do you?" "With the laptop decrypted, and Calloway's testimony, and the contractor in custody, yes. We have enough to open formal proceedings against 8 of the 14. The other 6 require Verrill or the Admiral's direct testimony, which is why today needed to happen the way it did." The Admiral, who was supposed to be resting, said from the bed, "Then we proceed." "Admiral?" "Captain Lords. I have a chest tube and a bruised lung, and I have been systematically poisoned by people who had access to my medical care for 6 days. I'm also awake and coherent and in possession of 14 months of documented evidence that I have been waiting to deliver under oath." His voice was measured and not loud, but it had the quality of something that didn't leave room for a counterargument. "Schedule the deposition. I'll need a recorder, your best technical equipment, and someone who can verify chain of evidence. I can do it from this bed." Lords looked at him. She looked at Emily. Emily looked back at her with an expression that said, "I've been trying to manage him since 7 o'clock, and you can see how that's gone." "Tomorrow," Lords said, "if your treating physician clears you." "I am the treating physician," Solano said from the doorway. She'd come back without anyone noticing. "And I'll clear him for a recorded deposition tomorrow morning if his drainage output is within normal range by tonight and he actually sleeps, which is a condition I'm enforcing regardless of his rank." "Dr. Solano," the Admiral said. "Admiral Dolan," Solano said pleasantly. "You had a chest tube placed 2 hours ago. I will unplug this television and take your phone charger if you don't close your eyes in the next 5 minutes. A pause. "You do it," he said. "Absolutely," she said. He closed his eyes. Emily stood and went into the hallway. Her legs were slightly unsteady in the specific way that happened after sustained adrenaline. Not weakness, just the body recalibrating, the system that had been running high coming back down to something closer to its baseline. She put her back against the wall and breathed. Lords came out a moment later. "The termination recommendation," Lords said. "Farr said it was going to review. It's been withdrawn, formally, with documentation." Calloway signed the withdrawal from the separation room 40 minutes ago. Lords paused. He also provided a supplementary statement indicating that his assessment of your clinical competence was inaccurate and influenced by external pressure and personal bias. Emily looked at the floor. She'd been in this building since before dawn. She'd eaten nothing. Her left arm had a bruise that was achieving genuine artistic ambition. She had performed a needle decompression on a man whose lung was being deliberately compromised. detained a trained operative with a defibrillator paddle, correctly identified a relay operator who'd been embedded for 6 weeks, and spent the better part of 4 hours being both the primary care nurse for a critically ill federal witness and the only person in the room who consistently knew what was actually happening. She felt less vindicated than exhausted. That was probably human. "The staff," she said, "the ones who were there this morning when Calloway tried to remove me, fell, the overnight team, the administrative coordinator. They'll be required to provide statements," Lord said. "I'm not asking for that." Emily looked up. "I'm asking whether they're being told what actually happened, because some of them, Doris Fell, Garrett, before everything else, they were just people in the building. They deserve to understand what they were in the middle of." Lord studied her. "That's a generous read on some of them." "It's an accurate one. Fell sent me in because she had no one else. The coordinator was following someone else's instructions. Garrett..." She stopped. Garrett was a more complicated story, and she was too tired to tell it simply. Garrett made choices he didn't fully understand the scope of. That doesn't excuse it, but it's the truth. "I'll make sure the briefings are thorough," Lord said. Emily nodded. She was about to push off the wall and go back to check on the Admiral's drainage when her phone buzzed. The same number as before, the one that belonged to the former NSA signals analyst who'd been locatable earlier and then wasn't. This time it wasn't 6 words, it was 12. "Laptop has a mirror, secondary drive, external. Pruitt has the location." Emily read it twice. Then she turned to Lord's and showed her the screen. Lord's face went through something swift and functional. She already had the radio up. "Pruitt is in federal transport," Marsh said through the speaker. "Stop the transport," Lord said. "On what basis?" "On the basis that our evidence picture just got more complicated." Lord's was already walking, the focused efficiency of someone who'd been doing this long enough that recalibration didn't require a pause. "And get me whoever is processing the laptop. I need to know if there's a sync protocol running in the background that we haven't killed yet." Emily watched her go. The hallway was quiet. Down at the nursing station, 2 of the afternoon staff had arrived for the shift change and were standing with the careful stillness of people trying to determine if it was safe to proceed with their normal duties. Emily recognized one of them, a senior nurse named Bet Warwick, who had been at Caldwell for 12 years and had looked at Emily on her first day of work with the particular calibrated skepticism of someone protecting an institutional culture she'd invested in. Warwick was looking at her now with a different expression. Not warm. That was too simple for what was on her face. More like a person revising a file they'd thought was closed. Emily walked toward her. "I need the IV antibiotic schedule for room 412 to transfer to the new room number. Can you pull that up?" "Yes," Warwick said. Then after a beat, "The Admiral, he's stable, post-procedure. He needs quiet and monitoring and someone to make sure his drainage output gets documented at every check." "I can take that shift." Emily looked at her. "You're 2 hours from the end of your day." "I know." Warwick's voice was even. "I can take it." Emily studied her for a moment. "Don't let anyone into that room without Lord's clearing them first. Anyone." "Understood," Warwick said. Emily gave her the room number and the clinical parameters and went back to check on him one more time before the secondary evidence crisis pulled everyone's attention further down the chain. The Admiral was not asleep. She hadn't expected him to be. He was lying still with his eyes closed, which was the closest he was going to manage, and when she came in, he opened them without surprise. "Lord's left fast," he said. "There may be a secondary evidence location, external drive mirroring the laptop." He was quiet for a moment. "Pruitt," he said, "we think so." "She's careful. She always had an exit." He paused. "The analyst who's been texting you." Emily looked at him. "You know who it is?" "I know who it might be. A man named Rafferty. He worked signals intelligence for 7 years and then spent 2 more years building a private audit of exactly the network I've been trying to surface. We've communicated through channels that don't log easily." He met her eyes. "He's been alone with that information for a long time. If he's surfacing now, it means he thinks the window is closing." "Or it means he's being pushed," Emily said. "Yes," the Admiral said. "That too." She checked his drainage, within normal parameters, slightly on the low end of output, which was actually preferable at this stage. His temperature was running a half-degree elevated, consistent with post-procedure inflammation and the underlying infection that was now finally being treated with the correct antibiotic. The wound at his forearm had been properly redressed by Warwick during the transfer, and the margins looked better than they had at 7 a.m. The bacteria in that wound had been fighting an antibiotic it was fully resistant to, and now it was fighting one it wasn't, and that difference was visible at the tissue level if you knew what to look for. She knew what to look for. "You're going to be all right," she said, not performatively, just as a clinical assessment stated plainly. "I know," he said. "I've had people keeping me that way." She set down the chart. "The deposition tomorrow. Lords is going to want preparation time tonight. If Rafferty has additional documentation and Pruitt gives up the secondary location, the scope of the testimony may be larger than what you outlined." "It was always going to be larger," he said. "I was just waiting for the room to be safe enough to say so." She understood that. She'd been managing her own version of the same calculus all morning, knowing more than she was saying, waiting for the moment when saying it fully would produce results rather than targets. Her phone buzzed again. Not a text this time. A call from the same number. She looked at it, looked at the Admiral. He nodded. She answered. The voice on the other end was male, somewhere in his 40s, and had the careful, pared-down quality of someone who had spent years reducing their verbal footprint to the minimum necessary. "You're still in the building," he said. "Yes?" "The secondary drive is in a storage unit in the Ferry District, Unit 114. Pruitt has the key, but the combination to the outer lock is the facility's original build date, which she thought was obscure enough. It isn't." A pause. "I'm telling you because Lords needs to hear it before Pruitt's transport team makes the mistake of being alone with her for too long." "Where are you?" Emily said. A longer pause. "Close enough that I could hear the loading dock situation from where I was standing." "Are you safe?" "That depends on what happens in the next hour." Another pause, and in it she could hear the sound of wind and traffic. He was outside, somewhere near the building. "I've been building the file on this network for 3 years. I've been alone with it for most of that time. I need Lords to have everything I have before I—" He stopped. "Before you what?" Emily said. The line went dead. She pulled the phone from her ear and looked at the screen. The call had lasted 41 seconds. The number was already showing as disconnected. She looked at the Admiral. His eyes were steady and grave. She went to the door, because Lordy's needed the storage unit information. And she needed it now, and whatever was happening to Rafferty somewhere near this building had just become the most urgent thing in a morning that had contained nothing but urgent things. But when she stepped into the hallway, she stopped. There was a man at the far end of the corridor. Not an agent, not hospital staff. He was standing at the junction where the hallway turned toward the elevator bank, and he was looking directly at her, and even from 40 feet away she recognized the quality of his attention. She had cataloged him this morning in 1.5 seconds. Height, build, approximate age, clothing details, scar above the left ear. Varel was supposed to be in federal custody. The man at the end of the hallway was not in federal custody. He was standing in the corridor of Caldwell Veterans Medical Center, looking at her with the focused attention of someone who had just found what they came back for. And his right hand was at his side, and she could not see what was in it from 40 feet away, but she understood with complete clarity that whatever happened in the next 10 seconds was going to determine the shape of everything that came after. 40 feet was not a lot of distance, and it was not a little distance. It was exactly the amount of space in which a decision had to be made before the decision made itself. Emily did not run. Running was information. It told him where she was going, it committed her to a direction, and it burned the one resource she needed most right now, which was the 2 seconds of uncertainty that existed in every confrontation before both parties understood the geometry. She also did not freeze, because freezing was the same as a decision, and she'd made hers before he registered the shift in her posture. She stepped back into the doorway of the Admiral's room and put her hand flat on the doorframe, not hiding, not retreating, just removing herself from the open corridor while keeping him visible. And she raised her voice to a level that would carry to the nursing station 30 feet in the other direction. "Warwick, radio Lords. Now. Subject in the north corridor." She heard Warwick move immediately, the scrape of a chair and then the radio. And that was all she could spare attention for because Varel had started walking. He walked the way he had that morning, the measured, purposeful efficiency that covered ground without looking like urgency. He was 15 feet closer by the time she finished the sentence, and she could see his right hand now. Nothing in it. That was worse, in a specific way, because it meant the calculation he was making was one he thought he could close with his hands alone, which meant he'd made an assessment of her that she intended to prove incorrect. She pulled the door to room 412 shut behind her. The Admiral was on the other side of it, and that was where she needed him to stay. Then she turned and faced the corridor, 10 feet. She could see the scar clearly now. Above the left ear, pale and lateral, old enough to be settled into the skin. She'd catalogued it in 90 seconds this morning, and she'd given it to Lords in a physical description that apparently had not been sufficient to prevent this, which meant something had gone wrong with the custody chain, which was a problem for the next 5 minutes. The current problem was the 8 feet now between her and a man who had come back into a federal medical facility after 2 colleagues had been taken into custody, which indicated either a level of commitment that was remarkable or a level of desperation that was dangerous, and she wasn't sure yet which one it was. "The laptop's been processed," she said. "The secondary drive location is already in Lords' hands. Varel, whatever you came back here to recover, it's gone." He stopped at 4 feet. His eyes were the particular flat gray of someone who had long since stopped processing events emotionally and now just processed them tactically, and what was in them was not rage or panic but a very quiet, very deliberate calculation. "The witness," he said, "is post-procedure and under monitoring and has 6 federal agents within earshot." She held his gaze. "And if you came back here personally, it means the operational structure above you is already collapsed, because nobody sends the person they can't afford to lose on a cleanup task, which means you're here because there's nobody left to send." Something moved in his face. Not much. Just the small, involuntary acknowledgement of a man hearing an accurate read. "You should leave," she said. "Not because I'm giving you permission, because the alternative is that you're found here having attempted something in front of 17 cameras and however many federal personnel are currently moving up the stairwell behind you." He looked at her for a long moment. She could hear the stairwell door at the far end of the corridor, the particular sound of it opening under pressure. Multiple people. The boot cadence she'd identified this morning as belonging to people who moved with purpose. Varel heard it too. His jaw set. The calculation ran its final iteration. He took a step back. Then Marsh was in the corridor with 2 agents flanking him, and the distance that had been 4 feet collapsed into nothing, and the situation resolved itself in the blunt, unglamorous way that most situations resolved when the math was finally settled. Bodies and positioning and the physics of being outnumbered in a narrow hallway, no drama to it, just hands and leverage and the sound of someone being walked back against the wall. Emily pressed her back against room 412's door and breathed. Her hands were shaking. She noticed this with the detached accuracy of someone monitoring their own system. Not a malfunction, just the body expressing what the mind had been suppressing for the last 90 seconds. She pressed her palms flat against the door until the shaking stopped. It took approximately 8 seconds. Then she opened the door and went back inside. The Admiral had not stayed in the bed. He was sitting up, both feet on the floor, the chest tube drainage system carefully displaced to his right side, and he was looking at the door with the expression of a man who had spent the last 3 minutes making peace with the possibility that the next thing through it might not be Emily Voss. "I told you to rest," she said. "I was resting," he said. "This is what I look like resting." "No, it isn't." She crossed the room and checked the drainage system. Undisturbed, readings intact, no tension on the tubing from his movement. She looked at his face. "He's in custody." "I heard." "The real one this time." He let out a breath. It was the first fully unguarded thing she'd seen him do all day. Just a breath. The particular quality of release that came from a man who had been holding a long tension and was now, finally, permitted to set it down for a moment. "Sit back," she said. He sat back. She checked his temperature, still marginally elevated, which was expected, and his oxygen saturation, which was 96 and climbing, and the wound at his forearm, which was receiving the correct antibiotic and showing the early tentative signs of responding to it. Then she sat in the chair beside the bed because her legs had decided, without consulting her, that standing was no longer a reasonable demand. "Rafferty," she said, "do you know where he is?" "I have a way to reach him. It's indirect." The Admiral looked at the ceiling. "He's careful. He's been careful for 3 years and he's still intact, which means the carefulness has been working." He said close enough to hear the loading dock. "Then he's still here." The Admiral's voice had the quiet certainty of someone reading a pattern they understood. "He'll surface when he's sure the variables are resolved." She thought about the 41-second phone call, the wind and traffic in the background, the voice of a man who'd been alone with dangerous information for 3 years and had just watched, from somewhere near the building, the sequence of events that determined whether those 3 years had meant anything. "He needs to talk to Lords," she said. "He knows that. He'll do it when he's ready." The Admiral paused. "You can't push Rafferty. He spent 7 years in signals intelligence. He knows every method of applying pressure, and he's immune to most of them." "What's he not immune to?" The Admiral was quiet for a moment. "Being believed. He's been carrying information that people kept finding reasons not to act on. He's not frightened of consequences. He's frightened of being accurate and mattering anyway." Emily sat with that. She understood it in the specific way you understood something when you'd lived an adjacent version of it. She'd spent 4 years in this hospital system being accurate about things people found reasons not to acknowledge, and the accumulated weight of that was not the same as what Rafferty had carried, but she recognized the shape of it. "Tell me how to reach him," she said. The Admiral looked at her. Then he told her. What happened in the next 6 hours was not a single dramatic sequence. It was the grinding, incremental work of a situation coming apart at its joints, the laborious, unglamorous process of consequence catching up to action. The storage unit in the Ferry District was opened at 1:17 p.m. Unit 114 contained a waterproof case with an external drive that was the mirror of the laptop's primary storage, along with 3 additional folders of physical documentation, printed, dated, signed, that Pruitt had been maintaining as a separate insurance file. The irony, which Lords noted without visible pleasure, was that Pruitt's exit strategy had been thorough enough to constitute its own prosecution exhibit. She had documented everything so carefully, so completely, in the event that she ever needed to prove her own indispensability to the network, that she had inadvertently created the most organized evidentiary record the NCIS technical team had processed in 4 years. Sandra Pruitt was informed of this at 2:03 p.m. in the federal transport vehicle, where she had been kept since Lords ordered the stop. The agent who told her described her response as very long silence followed by a single question about legal representation, which was the appropriate response and also the response of someone who understood completely what had just happened. Marcus Calloway completed his formal recorded statement at 3:45 p.m. It ran to 4 hours of interview time and covered 8 months of his involvement with the Meridian Group's interference in Admiral Dolan's treatment. His attorney, who appeared via video link from a city 200 miles away, interjected 11 times. Calloway overrode him on 6 of those occasions and kept talking. He was not a heroic figure in the statement. He was a frightened man who had made a sequence of choices he now had to enumerate in specific, documented detail. But he was thorough, and he was accurate, and he did not attempt to minimize his role in ways that would have been easy and been lies. When the interview ended, the lead NCIS attorney told Lords that Calloway's cooperation was the kind that came from someone who had genuinely decided to be useful rather than someone performing cooperation to manage their sentence. Lords told Emily this at 4:15 p.m., standing in the hallway outside room 412, in the matter-of-fact tone she used for information that was good news without being uncomplicated. "He'll face a licensing review," Emily said. "Almost certainly," Lords agreed. "He should." "Yes." Neither of them said anything else about it, because there wasn't anything else to say. Calloway had done harm, and then had chosen to do something useful, and both of those things were true simultaneously and would be sorted by the appropriate processes in the appropriate order. Garrett's formal statement took 2 hours. He was 24 years old, younger than Emily had thought, and he had been recruited through a professional network during his final year of his respiratory therapy program, offered a payment structure that amounted to more than his starting salary for what had been described to him as monitoring work. He had understood that what he was doing was not legitimate. He had done it anyway, and then the scope of it had expanded in increments that each felt small enough to manage, until he was standing in a room maintaining a radio jammer while a man's lung was collapsing, and the distance between that and where he thought he was starting had become impossible to see clearly. He would not keep his clinical certification. He would cooperate fully, and the cooperation would be weighted in his sentencing, but the professional consequence was fixed because the breach had been at the core of the professional obligation. Emily was not surprised by this and was not angry about it, and when Lords told her, she didn't say anything for a moment and then said, "Make sure he gets actual legal representation, not a public defender who doesn't have time for the file." Lords looked at her. "He made bad choices," Emily said. "That doesn't mean he should make them worse because he can't afford an attorney." "That's generous," Lords said for the second time that day. "It's practical," Emily said. "Cooperating witnesses who feel abandoned stop cooperating. You want the full file on the recruitment network? You need him to believe the process is fair." Lords made a note. Rafferty made contact at 6:22 p.m. He called the number Emily had used to reach him, the indirect method the Admiral had provided, which involved a specific messaging protocol that she didn't fully understand but had followed precisely. He called within 8 minutes of her message, which meant he'd been watching for it, which meant he'd been close enough to the building's communication footprint to know the afternoon's events had moved in the direction he'd hoped. She took the call in the hallway. "Where are you?" "Coffee place on Terrace and 5th, he said. "The one with the broken neon sign in the window." "I know it. I figured you might." A pause. "Is Lords actually good?" Emily thought about how to answer that. "She does her job without performing it. That's the best I can say about anyone." A longer pause. "That's enough. She needs everything you have, not a summary, the full file, the methodology, the chain of custody for the documentation you built independently. I know what she needs. Then she needs you to come in." The pause this time was different. Not hesitation, but the particular quality of someone standing at a door they've been approaching for a long time and finding, now that they're here, that the act of opening it is more complicated than the act of walking toward it had been. 3 years, he said. "I know. People I tried to bring this to before are not Lords," Emily said, "and this is not before. The laptop has been processed, Beryl is in custody, Pruitt's secondary cache is in the evidence chain, and the Admiral is scheduled to testify tomorrow morning. The structure that kept this from mattering is not intact anymore." She paused. "You held this for 3 years, and you kept it accurate, and you kept yourself alive. That matters. Now let someone else carry it for a while." A long silence. She could hear the coffee shop sounds through the phone, the ambient noise of an ordinary place, espresso machines and low music, and people having conversations about things that were not federal corruption networks. "Okay," Rafferty said. His voice was tired in the specific way of someone who has been tense for a very long time and is only now, in the permission of that single word, beginning to feel the weight of it. "Tell Lords I'll be there in 20 minutes. He was there in 17. He was shorter than she'd expected from the voice. Mid-40s, medium build, the kind of person who moved through spaces without leaving an impression, which was presumably a professional asset. He had the particular look of someone who had been sleeping in rotations and eating whatever was available and had long since stopped registering the physical cost of those habits. Lords met him at the facility entrance, which meant she'd cleared the security protocols, which meant she'd decided the approach to this mattered more than the procedure. She brought him to a conference room on the second floor that had been cleared of administrative staff, and she sat down across from him without preamble or performance, and she said, "Tell me what you have." He told her for 3 hours. Emily was not in the room for most of it. She was in room 412, where the Admiral was resting in the specific, determined way of a man who had accepted that rest was a clinical requirement rather than a preference, and where Warwick was monitoring his drainage output with the quiet, competent attention she'd promised. and where the evening shift had arrived and the building had settled into the different rhythm of a hospital after dark. Slower, lower, the particular institutional quiet that was not peaceful exactly, but was less embattled than the morning had been. She sat beside the bed and wrote her clinical notes for the day. It took a long time. There was a great deal to document. The Admiral slept. She watched the monitors and wrote and let the room be quiet around her for the first time since 6:14 a.m. Around 9 o'clock, Lourdes appeared in the doorway. She looked the way people looked when they'd received a large amount of information and were organizing it into a shape that would hold. She looked at the Admiral, asleep, breathing steadily, drainage within parameters, and then at Emily. Rafferty's documentation covers 42 months of financial transfers, 27 internal communications, and a procurement authorization chain that runs from Meridian Group through 3 subsidiary entities to the DoD Acquisitions Office, she said quietly. Cross-referenced with the laptop and Calloway's testimony, we have a complete evidentiary picture covering 11 of the 14 names the Admiral identified. The remaining 3. The Admiral's testimony tomorrow will address them directly. He has primary source documentation for those 3 that doesn't exist in any of the other evidence chains. Lourdes paused. This is going to be a large case. Federal proceedings across 2 districts, minimum. The scope. She stopped, organizing something. It's larger than I was briefed to expect when I came in this morning. Is that a problem? No, Lourdes said. It's just large. Emily nodded. She looked back at her notes. Then she said, the 2 senators the Admiral mentioned, the ones on the Armed Services Committee. We're aware. That's not an answer. No, Lourdes agreed. It isn't, but it's what I have right now, and I'm giving you the honest version instead of the official one. She straightened. Get some sleep, Voss. Come back tomorrow. I will. Lourdes left. Emily finished her notes, checked the Admiral one final time, gave Warwick the handover instructions, and walked out of Caldwell Veterans Medical Center at 9:47 p.m. through the same main entrance she'd used at 6:04 that morning. The parking lot was quiet. 2 federal vehicles were still positioned near the entrance. The night was overcast and salt-smelling, the particular smell of a coastal city after a long day, and she sat in her car for several minutes without starting the engine. Her left arm ached where the bruise had settled in. She was hungry in the particular sustained way that came from not eating for 14 hours. She was also, underneath the exhaustion, experiencing something she didn't have a clean word for. Not triumph, which was too clean, and not relief, which was too small. Something that felt more like the knowledge that a thing had been seen through. That the thing she had walked into at 6:14 a.m., not fully understanding what it was, had been seen through to its end. She started the car and went home. The deposition began at 9 a.m. the following morning. Admiral Harwick Dolan delivered his testimony from a hospital bed, sitting upright against the elevated headrest, the chest tube still in place, and the monitors running quietly in the background, wearing the same worn gray t-shirt he'd been in since admission because no one had thought to bring him anything else, and he hadn't asked. The formal elements of the setting, the recording equipment, the JAG officer, the federal attorney, the chain of evidence documentation, were arranged around the bed with the slightly improvised quality of a proper procedure conducted in an improper venue, which was its own kind of statement about the morning this had all started. He spoke for 4 hours and 20 minutes. He did not use notes. He did not hedge. He was precise about dates, amounts, names, and sequences to a degree that the federal attorney would later describe as exceptional for a witness at any stage of an investigation, let alone one who had spent the preceding day with a collapsed lung being actively prevented from testifying. He named the 11 people covered by the existing evidence chain and the 3 additional names that only his primary documentation reached. And for each of the 14, he provided the specific nature of their involvement, the timeline of their participation, and the documentation that corroborated each claim. He was also honest about the limits of what he knew. There were questions the attorney asked where he said, "I don't have documentation for that," or "I know this secondhand and I'll tell you where that account came from." And those moments were, in a way, more persuasive than the documented certainties, because they told everyone in the room that the things he stated with full confidence were stated with full confidence because they were true, and he knew the difference. Emily was not in the room during the deposition. She was on the floor doing her job, which included that morning a routine dressing change for a veteran in 403, a medication reconciliation for a patient in 408 who had been discharged and brought back in with a complication, and the ongoing monitoring of the Admiral's drainage output and wound margins, which she conducted at the door of the deposition room during the scheduled breaks. The Admiral, during the second break, looked at her and said, "How is the arm?" "Colorful," she said. "I'm putting it in the formal record." "You don't need to do that." "I know I don't need to." He held her gaze. "I'm doing it anyway." She didn't argue. He was the kind of man you argued with when you were right, and let alone when he was. The legal proceedings that followed were not swift. Federal cases were not swift. The indictments came in stages over the following weeks, the charges building outward from the core evidence like rings expanding from a dropped stone. Meridian Group's senior contracting officers first, then the subsidiary network, then the DoD acquisitions personnel, whose authorization signatures appeared in the documents, then the longer and more complicated process of the two senators, which moved through a separate and more politically fraught channel that took months and involved its own legal architecture before arriving at the same destination. Sandra Pruitt was charged with federal obstruction, conspiracy to commit witness tampering, and accessory to the unlawful modification of a federal patient's medical treatment. She pleaded not guilty, and then 6 weeks later, pleaded guilty to all 3 counts in exchange for a cooperation agreement that her attorney spent considerable effort negotiating and that the federal attorney spent less effort accepting than Pruitt's team had anticipated. She received a 4-year sentence, the minimum the agreement permitted, and was permanently barred from any administrative role in a federal medical facility. Her husband, Damian Pruitt, was charged separately with federal procurement fraud, conspiracy, and financial crimes that traced across 4 years of Meridian Group's contract history. His trial lasted 11 days. He was convicted on all counts and sentenced to 9 years. He did not look at Sandra during the sentencing, which the court reporter noted in her personal record of the day as a detail she found significant for reasons she couldn't fully articulate. Marcus Calloway's medical license was reviewed by the state licensing board over a 3-month process that was thorough and unhurried, and arrived at the conclusion that his continued licensure was not consistent with public trust in the profession. His license was suspended for a minimum of 5 years, with a pathway to reinstatement that required demonstrated remediation and a board review. He accepted this without appeal. He did not contact Emily, which was the right choice. Garrett Owens, the respiratory tech who was not a respiratory tech, entered a cooperation agreement that resulted in a reduced charge of 1 count of federal obstruction. He was sentenced to 18 months probation and 200 hours of community service, with a permanent bar from healthcare employment. The attorney who represented him was not a public defender. Emily had made a call, and the person on the other end of it had owed her a favor, and the favor had been used. She didn't tell anyone she'd made that call. It wasn't the kind of thing that required an audience. Varel, whose full name was Tobias Verrill, and whose pre-Meridian record took 6 weeks to fully surface from the classified layer it had been filed under, was charged with federal conspiracy, witness endangerment, unlawful entry of a federal facility, and charges related to the specific nature of the wound delivery mechanism that had been used on the Admiral, which required a classified legal framework to prosecute and which took longer than the other charges to formalize. He received 12 years. He did not cooperate. He did not express anything recognizable as remorse. He sat through his sentencing with the same flat tactical attention he'd had in the corridor of the 4th floor, and the judge, who had 20 years of federal bench experience, noted in the sentencing statement that Varel's detachment from the human consequences of his actions was itself a fact the court found relevant to the length of the sentence. Of the 14 names the Admiral had identified, 13 were ultimately charged. The 14th, one of the 2 senators, was not charged due to evidentiary limitations that Lords explained to Emily in careful, precise language that she understood to mean, the case is real, but the political protection is currently more durable than the evidence, and we are choosing a conviction we can hold over a charge we might lose. Emily understood the logic. She didn't have uncomplicated feelings about it. Rafferty was not charged with anything. He was, after some internal debate at the agency level, formally recognized as a cooperating source whose independent documentation had been essential to the scope and integrity of the investigation. He did not attend any of the trials. He moved somewhere else, somewhere quieter. And the method the Admiral had used to reach him went dark after the last court date, which Emily took to mean he had decided that the thing he had needed to finish was finished. She understood that too. The formal recognition ceremony for Emily Voss took place 6 weeks after the final sentencing. It was not a large event. It was not, she had specified, going to be a large event. Lords had initially described a formal military ceremony with presentations and full attendee list and the kind of institutional pomp that generated photographs for official records. And Emily had said, clearly and without apology, no. They had negotiated it down to a ceremony in the conference room on Caldwell's second floor, the same room where Rafferty had talked to Lords for 3 hours, with approximately 30 people present. The Admiral was there, 3 weeks out of his chest tube and moving with the careful deliberateness of a man whose body was operational again, but had not forgotten what it had been through. Lourdes was there. Solano had driven in from Harmon Regional. Doris Fell was there, and Warwick and Garrett, who came because Emily had told Lords to extend the invitation, and who sat in the back row and didn't say anything, and whom Emily acknowledged with a nod when she walked in, that he returned with the specific expression of a person who had not expected to be treated as a person in this particular room. Administrator Gideon Farr was there. He gave remarks that were brief and specific and did not attempt to paper over what had happened in his facility, which Emily appreciated. He said the phrase institutional failure twice in 3 minutes, which, in the language of administrative remarks, was the equivalent of a direct statement, and he meant it. The citation was read by Lourdes. It was a federal document, formal language, the particular construction of official recognition that was precise in the way legal documents were precise, describing actions in terms of their category and consequence rather than their emotional texture. It cited the needle decompression, the identification of the infiltrator, the correct diagnosis of the evolving pulmonary compromise, the relay operator identification, and the containment of the corridor confrontation. It used Emily's full name, her former service designation, her call sign, Ghost Finch, spoken aloud in a conference room full of people, most of whom had never heard it before, and none of whom could know what it had cost to earn. She stood at the front of the room and let it be read, and did not look at the floor, and did not perform anything. When Lords finished, she handed Emily the framed document and shook her hand, and that was the official portion of the ceremony concluded. Then the Admiral stood up. He did it without asking anyone's permission, which was consistent. He was using the kind of posture that was not quite at attention, but carried the architectural memory of it. A man who had stood in formal configurations for 40 years, and whose body retained the shape even when he was in civilian clothes in a conference room. He looked at the room. He looked at the staff who had been there that morning, Fell, Warwick, the 2 nurses who'd been at the station, and he said without raising his voice, "You made an assessment in the first 10 minutes of knowing this woman. Most of you made the same one. I'm not going to ask you to feel bad about it, because that's not useful." He paused. "I will ask you to remember what happened when the assessment turned out to be wrong, and to think about what it cost to be wrong, and what it cost her to correct the record in the way she did." He looked at Emily. The uniform she wore when she came to work that morning was the one you saw. It was not the only one she'd earned. Nobody in the room said anything for a moment. Then Doris Fell, who had been a charge nurse for 19 years and had not cried at anything professionally in at least 11 of them, looked at a point somewhere above Emily's left shoulder and blinked several times in rapid succession. The Admiral, to his credit, did not observe this. He sat back down. After the formal part of the ceremony, people stood around and talked in the way people talked at events like this, careful and slightly awkward, the particular social texture of a group that had been through something together and hadn't yet developed the vocabulary to discuss it comfortably. Warwick told Emily that she'd been wrong and that she was saying it once and would not make a habit of extended apologies, which was exactly the kind of direct, sensible statement Emily respected. Fell said nothing specific, just stood beside her for a moment with the quality of someone who wanted presence to stand in for language, and that was enough. Solano found her near the window with 2 cups of coffee and handed her one. "You look tired," Solano said. "It's been 6 weeks of depositions and clinical catch-up and a performance review that Farr made the licensing board conduct. even though the initial recommendation had been formally withdrawn. How did the review go? They found no basis for any of Calloway's characterizations, Emily said, which is a formal way of saying I was right and he was wrong, and the record should reflect it. Does the record reflect it? Yes. Solano drank her coffee. What are you going to do now? Emily looked out the window at the parking lot, which was ordinary and overcast and contained nothing more dramatic than a laundry service truck making a delivery. She thought about the question. She thought about the 4 years she'd spent in this building being assessed as inadequate by people who did not have the context to make that assessment, and the morning that had required her to be every version of herself at once, the nurse and the medic, and the person who'd stood in corridors without names, and made decisions that couldn't be undone, and had learned to live with the ones she couldn't improve. She thought about what it meant to have been right about all of it, and whether being right was the point. She had thought, after the Army, that she was done with the kind of work that required her to keep whole portions of herself stored in compartments that couldn't be opened in front of the people she worked with every day. She had thought nursing was the thing that let her put those compartments down and just be present with people who were sick and needed someone to stay in the room with them. What the last 6 weeks had taught her, what the morning in room 412 had demonstrated in the most complete way possible, was that those two things were not actually separate. The medic and the nurse, and the person who said call signs in a language nobody else in the room understood, and the person who pressed her palms against a door until her hands stopped shaking, they were all the same woman. The compartments were a fiction. She had always been whole. She just hadn't been in rooms that acknowledged it. What I was doing before, she said, but with fewer people telling me I shouldn't be. Solano smiled. That's a reasonable ask. FAR has already proposed a new clinical liaison role between the nursing floor and the Federal Patient Coordination Team, better protocol for veteran care, mandatory training on military communication frameworks, a direct line between floor nurses and the oversight office when something looks procedurally wrong. Emily drank her coffee. He wants me to help design it. Are you going to? I'm going to do it while keeping my patient assignment, Emily said. I'm not leaving the floor. Of course not, Solano said, like that had been obvious. Oh. On a Thursday morning 3 weeks later, Emily arrived at Caldwell Veterans Medical Center at 6:50 a.m., which was slightly late for her, and signed in at the nursing station and picked up her assignment list and poured a coffee from the break room machine, which was still burning the coffee and still not being fixed, and went to start her rounds. The Admiral had been discharged 2 weeks earlier at his own request and against the mild protest of the thoracic team, who wanted 1 more week of inpatient monitoring. He had signed the AMA paperwork with the specific practice deficiency of a man who had discharged himself against medical advice before and had developed a technique for it, and he had shaken Solano's hand and walked out of the building under his own power. Before he left, he had stopped at the nursing station where Emily was documenting. He didn't say a great deal. He said, "The depositions are complete. The chain of custody is intact. The process from here belongs to the attorneys and the court system, and I can stop being a target for the first time in 14 months. A pause. That's because of you. That's because of the evidence, she said. The evidence got to Lords because you were in the building, he said. Don't minimize the mechanism. She had looked at him for a moment. Take care of yourself, Admiral, she said. You too, Ghost Finch. He left. She went back to her documentation. That shot. The work she did was not spectacular on most days. That was the nature of it. Floors were checked, medications were verified, wounds were dressed, pain was managed, families were talked to in the specific language of people who needed information and also needed to be told that someone in this building was paying close attention. The veterans on her floor came in broken in various ways and left less broken, or came in dying and left having been seen, and the scene mattered even when it wasn't enough. She knew that. She had always known that. It was the thing that had kept her here when the building's institutional culture was working against her, and the administrative pressure was accumulating, and the daily evidence suggested that her assessment of her own worth was more generous than the institution's. She had been right. The institution had been wrong. Those were facts, and they were in the record now, and the record was public, and she had not needed to become someone else to put them there. There was something worth sitting with in that. Not pride, exactly, which was too simple. more like the knowledge that the things she had suspected about herself, that she was capable of doing what this work actually required, on the hardest possible day, under the worst possible conditions, had been tested in the most complete way available and had held. She was 30 years old. She had a bruise that had faded to a yellow-green on her left forearm. She had an official commendation in a frame that was currently leaning against the wall in her apartment because she hadn't gotten around to hanging it. She had a ward full of veterans who needed someone to stay in the room with them. She went to work. That was the thing about people who were told they didn't belong in the rooms they walked into. Sometimes they walked in anyway, and the room rearranged itself around them. And what looked like stubbornness from the outside was, on the inside, just a refusal to accept someone else's inventory of your worth. You didn't have to be loud about it. You didn't have to announce it. You just had to keep showing up, keep doing the work accurately and without apology, and trust that the day would eventually arrive when the record spoke for itself. The record had spoken. Emily Voss pulled on a fresh pair of gloves and went to check on her patients.